There are many parents and their children who ask me about how is orthopedic surgery as a career, or how do we go about getting into orthopedic surgery. Hello, I'm Dr. Tejas Upasani, practicing orthopedic and joint replacement surgeon since the past 20 years. I am the managing director of Upasani Super Speciality Hospital, which is a multi-speciality 60-bedded hospital in Mulund, and also the first to introduce robotic assisted knee replacement in Mumbai. There are many parents and their children who ask me about how is orthopedic surgery as a career, or how do we go about getting into orthopedic surgery. Now, since if you're a student of medicine, and I believe you've taken medicine for some reason that you want to, you like to do something which helps other humans, and which you like to cure people and relieve them of their pain. I believe as an orthopedic surgeon, your main aim is to reduce the pain of individuals because either of fractures or because of arthritis, because they are suffering a lot because of the pain. And I think as an orthopedic surgeon, that gives me the most satisfaction, because you're relieving people of their pain, you're improving their lifestyle or their life, not the longevity of the life but the quality of their life. So if you want that adrenaline rush of an intensivist, or of treating, or you just like prescribing medicines, I think going for pediatrics or medicine is a better option. But if you like to operate, if you want to become a surgeon and you really like to do something different, I think orthopedics is your cup of tea, because orthopedic surgeon, though there's no much of medicine in it, but there is a lot of surgery. Though if you want surgery only to be like dissecting, and if you're I feel the exposure that you have in MBBS to orthopedic surgery is quite less, so you don't have much of an idea of how orthopedics is, or what happens exactly in orthopedic surgery. Really, when I started my residency, I was like, for the first 6 months, I was like, I think I don't want to do orthopedics, because the first 6 months of your residency, when you are the junior most houseman in the unit, you are just running around and doing all the things that you think is not at all a part of being an orthopedic surgeon. So once you're finished with your first 6 months, and then you really get into and understand orthopedics, and when you start operating, I think that is the time you really start knowing a bit of orthopedics. And I believe when you really understand orthopedics is after you've done your MS, and when you work with some senior surgeon, when you see how they operate, and you also start to understand the biomechanics. As an orthopedic surgeon, you also need to know a bit of physics, because there is a lot of mechanical things associated in orthopedic surgery. You need to know about metallurgy, you need to know how things, the pressures, the tensile strength about different things, compression. So there are many things, but to begin with, I believe it's a very good branch, because if you want to do surgery, if you don't want your training to be too long, because if you do general surgery, then I believe nowadays nobody likes to stop at just being a general surgeon. You need to again super specialize, either become a gastroenterologist, become a laparoscopic surgeon, uro, or a cardiac surgeon. So the best thing about orthopedics is, you get to know, you become a surgeon, and then again maybe now even orthopedics is going and developing into, I would say, sub-super specialities. Like in orthopedic surgeries now, joint replacement is another specialty. You have spine, you have foot and ankle surgeon, you have pediatric orthopedic surgeon, you have an hand surgeon. So in orthopedics also, it's got a vast scope, and getting there may not be as easy as it is shown in some of the movies. I wish it was that way. So I believe in your NEETS course, that is the National Eligibility and Entrance Common Test, you need to really score well, because I believe orthopedics is still a demanding branch. And if you need to go into a good hospital or a good teaching institute, you need to be maybe in the first 2,000 to 3,000 rank with NEET. And I believe now the number of seats have increased